Go, Mom, you can start.
Good afternoon, friends. I'm Dr. Kripa, working as an associate professor in Department of Physics and Joseph College of Engineering. This week is Doctors Week. I welcome you all for this Joseph's Virtual Healthcare Week. First, I like to thank God for giving one more day in our life, even in this pandemic situation. And He has made all of us to see each other through this virtual communication. And then I like to thank our chairman, Dr. B. Babu Manoharan, Mrs. Jessie Priya, our managing director, and Mr. B. Sashi Chekhar, director of St. Joseph Group of Institutions. I like to extend my thanks to our principal, Dr. Vaddi Seshagiri Rao, and Dean, Dr. B. Parvadavardhini. And at last but not the least, I like to thank Dr. V. N. Nandini Devi, head of the department. With the constant support and the encouragement of all of them, this event is happening now. Friends, I think we can see a small video of our college. After that, we can go for the presentation. Yeah, thank you, friends. Since this week is full of Doctors Week, on behalf of our college and department, I'd like to offer our heartfelt thanks and appreciation to all the doctors and healthcare workers. I start with a quote. The beauty of a woman must be seen in her eyes, because that is the doorway to her heart, the place where the love resides. Yes, we are going to see one such woman who was born at New Delhi. She completed her MBBS and MS Ophthalmology under Delhi University. She has been honored by Vitreous Retinal Fellowship. She started her noble profession as senior consultant and head of the Department of Uveitis, which was founded and developed by her in Shankara Nethralaya Hospital. She has presented many papers in both national and international conferences. Also, she is an author of 2 books about eye care. She is a pioneer in a phacoemulsification surgery, which she mastered in USA. She has 43 years experience in all eye-related treatment. Above all, even though she is one among the top ophthalmologists, she readily extends her hands to the needy and poor people. She and her team have conducted so many eye camps for the poor, special children, and elderly people in and around Chennai. She is none but Dr. Rajni Kantha Narendranath. Ma'am, welcome, ma'am. We are very
Thank
happy and proud to have you here. Now the screen is yours.
Thank you so much, Dr. Kriba, for that wonderful introduction. I'm really grateful to you. I'm grateful to the Department of Science. I'm grateful to the dean, the principal, and so many people who have worked on this symposium, science medical symposium. I'm grateful to each and every one of you. Such a wonderful job you people are doing. And I'm so grateful that you gave me an opportunity to share a few tips about eye care in this program, and I'm sure it will be useful to each and every one of you. I'm really thankful to you for everything that you've done for me. You've been more of a friend to me than a coordinator or anything. So I thank everyone for having given me this opportunity. And hi everyone, and it is so lovely to be in this program. I'm so glad that I'm in this program, and I'm thrilled to be with each and every one of you. And I sincerely hope that this is a simple program which is easily understandable by everyone, and everyone benefits from this program. May God bless you all.
Ma'am, you can share the screen.
Yeah. The topic for today is eye is a living camera. I chose this topic because eye is a very important part of the human body. We need eyes as long as we live, and everything we do, we understand, we perceive is through the eyes. And so I thought this is a wonderful topic, and I'll be sharing a few tips on this program. I have entitled the program as "Eye is a living camera" because eye and the camera can be compared in very many ways. One is in the camera, in the original camera, not the digital camera, but the original camera. How it was designed was there's a lens inside the camera which focuses whatever image we want to click. It focuses on the image, and then as we focus it and click it, the image gets formed on
Ma'am,
the film.
excuse me, ma'am. Ma'am, you can make the screen as a full screen. You can have the slideshow, ma'am.
Yeah.
Yes, perfect, ma'am.
Yeah, so this is a camera. We all know the original camera, which was invented a few decades ago, and that this is used to capture images of people and object and things like that. What was the mechanism behind it was the camera will focus. It is a lens, optical system, and it focuses on the object, and then as we click it, the image of the object falls on the photographic film. There will be a photographic film, and then this film is unloaded, and we take it to the studio where it is given for development in the dark room. In the dark room, the film is developed from a negative. Then negative prints are taken. Then it is converted into positive prints, and then the final prints are taken. That is how this works. The original camera. If you compare the eye with this camera, eye does exactly the same thing. Now you are looking at the eye, and in the front portion of the eye, there's something known as the the cornea, the front portion of the eye, there is a very transparent dome known as the cornea, and inside the eye there is a lens, clear lens. So the cornea and the lens, they focus whatever we are seeing. It could be a person, an image, it could be an object, it can be anything. It focuses that onto the retina, which is comparable to the photographic film. Then once this image is focused onto the retina, then the retina is a multi-layered structure which has millions of nerve fibers. Through these nerve fibers, the image goes through the optic nerve and to the visual pathway and then to the brain, a part known as the visual cortex. And here it is processed at the occipital cortex, which is that is where we see. So we are not seeing at the eye level, but we are seeing at the brain level. This will come as a surprise to many people who will be thinking, how come we see with the eye? Actually, we see with the brain. That is a very important and new piece of information I might be giving to many of you. The eye only captures the image. What we are seeing, which person, what objects, that we perceive only at the brain level. Now, eye is shaped like a ball. What we see is here. Like this is what we see, and many people think that that's all the eye is all about. One small area in the face. It is not true. This is just the front portion of the eyeball. The eye is a very important structure. So the front portion is the only thing which we can see. It is protected by the eyelids here. Then the whole eyeball is kept in the orbit or the socket, because it is covered by bones to give it protection. And actually the eyeball will be something like this, not so round. It is more of a like egg-shaped eyeball, and it is about 2.4 centimeters in length. That is the average. It can be a little smaller, it can be slightly bigger, and it is inside the socket where it gets 100% protection from injuries and other things. And what we see is just the front portion of the eyeball, only the front portion. The rest of it is inside the orbit of the skull, and well protected from injuries and other things. So this is the vertical section of the eyeball. We saw the eyeball. This is the vertical section. I was telling you about a crystal clear structure in front of the eye known as the cornea. This is comparable to the wristwatch glass. We all have a glass on the wristwatch, which is 100% transparent, and what we see is only the dial at the back. We don't see the glass at all because it is 100% transparent. Similarly, we never see this cornea. What we see is the colored iris at the back. We all know this. This can be blue colored, this can be green colored, it can be brown. Indians, most of us have brown colored iris. So what we see is the iris and not the cornea. But cornea also focuses the objects onto the retina. This is the clear lens, just like a camera. The camera has a lens. The eye also has a lens, which is again 100% transparent. The cornea is 100% transparent. Then the lens is 100% transparent. There's a fluid here, which is also 100% transparent. So whatever we see is focused by the cornea and the lens onto the retina at this portion. This is the most important point of the retina. And the retina is a highly innervated structure. Millions of nerve fibers are there in the retina. So the information we get here, it goes through the optic nerve. It goes through the optic nerve to the brain. As I told you earlier, the image is focused at it is focused here, but finally all the images are the neuronal image thing is transmitted to the brain. This is the retina on which the image focuses. This is the most important point of the retina. If you have any retinal problem, any retinal pathology like a macular degeneration, this is the most important point known as a macula. This is where the image forms. When we look at somebody, when you look at any object, the image forms here, exactly this point at the retina, most sensitive and most powerful area of the eye. And this is the optic disc. This is the place where the optic nerve starts. And this retina is orangish in color and has millions of nerve fibers. All these nerve fibers go through this optic nerve and to the brain. So this is a normal optic disc, normal retina. This is where the image gets focused. Now, this is the right eye, this is the right eyeball, and this is the left eyeball. Now, the information, both eyes see the same object. When we look at something, both the right eye gets an image, left eye gets an image, identical images they get, and then they go through this optic nerve in the brain. This is all inside the brain, and it goes like this. Then there is some decussation here. Then it goes through the optic radiations. Then it comes here, it radiates like this, and finally this is the visual cortex. This is the area where we see and we perceive that this is what we are seeing. So the image travels quite a bit of a distance from the eye. It comes through the optic nerve, goes through the visual pathway. Finally, it comes to the visual cortex, where we can know that this is the image. This is what we are seeing. This is a ship. This is a flower. This is a butterfly. This is my father, my mother. Anything. The perception is done here in the visual cortex. That is why when there is an injury to the head injury here, if this part of the brain gets damaged, then one can become blind. Though the eyes are absolutely normal, the eyes may be structurally normal, but if this area gets damaged, or if there is a damage in any part of the visual pathway, then the vision may not be very good. What is vision? That is the ability to see distant vision. What do we mean by distant vision? We look at the star, we look at the bird sitting on a tree far away, we look at the vehicles coming in the opposite direction as we drive, the bus numbers, the blackboard in the school classroom. All this is distant vision. A television which is kept about 15 feet away. The images which come from these distant objects is known as distant vision. Our eye is such a excellent organ. It can see the distant vision. It can also see near vision. Now, what do we mean by near vision? When we do stitching, that is near vision. When we read a book, when we look at the laptop, when we are doing some embroidery or some cutting a vegetable, everything is near vision. This is all near vision. So the eye is able to see the distant vision. It is able to see the near vision. And also there's something known as the field of vision. When we talk about the distant vision and the near vision, we are talking about the central vision. And everybody is happy when the central vision is okay. They're able to see the TV, they're able to see the book. Everybody is happy. But there's something known as a field of vision, which is the side vision. So though I'm looking at the camera, I can see the portion of the room above the camera, to the side of the camera, below, and that is known as the side vision or the field of vision. This is also very, very important because when we cross a road, we should know the vehicle is coming at the other side, or there's a hole in the road, or there's a stone there, or some obstruction. So the field of vision is very, very important for us to avoid accidents and to know a full view of the picture we get only because of the field of vision. And there's something known as a color vision. We all know that. That's a beautiful world we live in, full of color, birds, so many beautiful birds and flowers and insects and so many. It's a beautiful, colorful world. And color vision is a very important thing. Those who are totally colorblind, there are various forms of color blindness are there. It could be red-green deficiency, it could be blue-yellow deficiency, it could be a partial color blindness, it could be a total color blindness. Unfortunately, those people who are totally colorblind, they can only see black and white and some shades of gray. And most of the animals also do not have a color vision. So we are so lucky as human beings that we are able to see color, and we are able to perceive this beautiful world in all its colorful splendor. There's something known as binocular vision also. Binocular vision means the right eye gets an image, the left eye also gets an image. There's a slight difference between the images. They fuse in the brain, then we get one single vision. That is known as binocular vision. What is the advantage of a binocular vision? We can see depth, we can see 3D, the three-dimensional picture, and also stereopsis. So these three we are able to do because of the binocular vision, and those people with only one eye will be able to see only the monocular vision. Now, it's important to assess the central vision, that is the distant vision, how much we have, how much near vision we have. Then we'll be able to see whether the person has got 100% vision or 80% vision or 70%. What is the exact vision the person is having? We can assess. This is very important. This is a Snellen's chart with which we examine a person. We ask them to close one eye, sit at a distance of about 6 meters, and then we ask them to read. Close one eye and read with one eye. Then we know that suppose they are able to read this first letter only, that means they have what is known as 20 by 200 vision. If they're able to read the second line also, then it is 20 by 100. Then the third line, 20 by 70, like that it goes. The 100% vision is what if they're able to read the last line, sitting at 6 meters distance away from the chart. So this is what we call it as 20 by 20 vision. In the British system, it will be 6 by 60, 6 by 36, 24, and so on. And finally, we have what is the 20 by 20 is equivalent to the 6 by 6 of the British system. This is the American system. We check each eye. One eye is covered, we check the vision. The other eye is covered, we check the other eye's vision. Then we check the near vision. This is also, it starts with bigger print and then it becomes a smaller print. The font sizes are different. This is bigger font size. Then as we go down the chart, it's a very fine font size. N5 or N6 are considered as normal near vision. Now, when this vision is not okay, that is the distant vision is not all right, or if the near vision is not all right, then we call it as a refractive error. It is of different types, the refractive error. One is myopia. This is here. That is when we see, we are not able to see what is at the distance, and we can only see what is nearby. That is known as short-sightedness also. And many school children, many people have myopia. It's very common. And hypermetropia or hyperopia is just the opposite. They'll be able to see all near things, like reading a book will be easy for them. It will not be easy for them, but they can see the distant vision. Opposite of myopia is hypermetropia. That is, they can see the distant vision, but they won't be able to see the reading. Presbyopia is something which comes at the age of around 40. Many of us, maybe at 38, 39, maybe 41, 42. That is because of changes happening inside the eyeball. Some aging process takes place inside the eyeball. So they will come and tell us, we were able to see distant vision, we had perfect near vision, but for the last few months, the small prints in the book are not very clear, or we are not able to stitch. This is the complaint. They'll come, that their age will be somewhere around 41, 42, and we check and we give them reading glasses. They all require reading glasses. Astigmatism is a condition where the cornea is not curved in proportion in every axis. It is not the same power in every axis. In one particular axis, it may be more, it may be less. It's a corneal astigmatism. Some people have this also. We check this refractive error with the equipment known as the auto-refractometer. The person who is getting checked will sit on this side, keep the chin here, and the forehead will rest on this thing. The person who's checking will be on this side. We'll get the reading. Then we put it on the trial frame and we counter check the reading. And we'll ask them, we put different trial lenses and ask them whether this is better or that is better. And when they say this is the best I can see, this is the wonderful lens, they can see very clearly and they're able to read the last line 20 by 20 or 6 by 6, then we take that power as the right power and we prescribe them the treatment for the refractive error, which we have various choices. One could be spectacles. It could be spectacles. It could be contact lenses. It could be LASIK laser also. Spectacle has an advantage because it is easy to wear, and you can remove it. You can wear it whenever you want, and there are various types of glasses are there. Photochromatic, photo gray, photo brown glasses, plastic, CR39, like that. So many varieties are there. And we have anti-reflection coating can be given over the spectacles. Anti-glare coating can be given to those people who use the computer a lot. And so spectacles can be modified, scratch-proof it can be when you give plastic lenses. So spectacles also varies. It can be given in various ways, whichever is suitable for the person. We decide and we decide what to give and we give them. So that there are Some people will say, no, we don't want to wear spectacles. We would like to go for this contact lenses. We do prescribe contact lenses. There are various types of contact lenses are available. And there are some people who will say, no, we don't want spectacles. We don't want contact lenses. We want to be free of glasses. We want to be free of lenses. For those people, we advise what is known as the LASIK laser. It is a LASIK procedure, a laser procedure, which we do to remove the refractive error. As I mentioned to you, this is a spectacle. The glasses are fitted here, which is of different variety and kind, and the frames are different. This is a contact lens which you see. There are various types of contact lenses: hard contact lenses, semi-soft contact lenses, gas permeable contact lenses, then daily wear, daily disposable, quarterly disposable, monthly disposable. So many varieties are there. There are cosmetic contact lenses which are colored, which have color. This could be green in color, it could be blue, it could be brown. So sometimes people wear it according to the dress which they wear when they go for a party or they go out. They want to wear matching contact lenses. Those are known as cosmetic contact lenses that also we can give. So this is something which is stuck onto the cornea here. Of course, we teach them, we educate them on how to wash the lens, how to wash the hands first, wash the lens with the lens cleaning solution, and then insert it. We give coaching also. We train them how to put the lens inside, how to fix the lens inside, how to remove the lens once 8 hours or 9 hours have passed off, then how to remove the lens. We give training once when they are 100% confident that they will be able to wear this and remove this all by themselves. Then these lenses are dispensed with. Of course, daily use, daily wear, daily disposables are very convenient. You can just remove, put it on from the container, and you can just remove it and throw it. The next day you can take a fresh pair of lenses and wear it like that. So the chances of infection is very, very limited. And as I mentioned, those people who don't want either of them, and we check them for, there are people who do ask for this procedure. And the most important criteria is that they should be more than 18 years of age. Below that, we don't do. For small children, we don't do. We wait till 18 years of age, because the eye grows till then. The growth of the eye stops nearby that age, 17, 18, 19. So we wait till 18 years. And also, we see to that there is a stable refraction for more than a year's time. There should be a stable refraction. It should not be changing. It should not be -3 this year, next year -4, next year -5. If it is something like that, then we wait till the refraction is stabilized, and then we do the laser. There are various forms of types of LASIK laser. One is a PRK. Then that could be femtosecond LASIK laser. That could be intra-lase. And there's a procedure known as smile procedure, where we don't make a flap. In these procedures, we make a flap, and then we modulate the eye. We modify the cornea so that the power they have, -4 or -3 or whatever power they have, gets neutralized. This is the LASIK laser equipment. We make the person to lie down on this couch. They're comfortable. There's no pain. Absolutely painless procedure. Less than a minute it takes. No injection, just drops. And then the machine is fed all the information about the cornea of this thing. We do an op scan. That's a test which we should do before we do a LASIK procedure. All the information of the op scan is in this machine. It is inside the laser machine. And once we start, we are there, and then the cornea is modified, and the -7 or -6 or +3, whatever, that gets neutralized, and the person is able to see even without glasses or contact lenses. Now, when babies are born, they don't fix their eyes immediately. The newborn baby, when we talk to them or when we sing to them, the eyes will move here and there. And it takes about 6 weeks to around 3 months' time for the fixation to develop. What is fixation? When we show a toy or we talk to them, they start looking at the mother's face or the father's face, you show a toy and say, you make a noise, and then they look at the toy. They're able to fix their eyes on the toy, on the object, on the mother's face, and that is known as fixation. And that develops only after about 6 weeks. It develops. But if in case one must see the doctor if the baby's eyes don't fix. If more than 3 months have passed by, the eyes are not fixing, it is going here and there, it is not fixing on an object, it is not fixing on the parent's face or eye or mouth, then we should go and take a consultation with the ophthalmologist. Also, when the baby's eye is moving like that, constant shaking or moving, that is known as nystagmus. If does not fix also, if it keeps moving, also we should take a consultation. And also when the pupil is the black portion in the center of the iris, and if that black portion is white, then also we should take a consultation. Also, if there is a cross eye or squint, we should have a consultation with the eye specialist. A squint is also known as cross eyes. That is when the eyes are not parallel. See, this is a picture. This eye is normal. In this child, this eye is normal. It is fixating. It is looking straight. But this eye is moved in towards the nose. It is moved towards the nose. And this is known as the convergent squint. This is a convergent squint, and also we know the degree of squint. If the squint is, we can easily know whether it is if the light reflex falls here, it is 15 degrees. If it falls in the center of the iris, it is 30. If it falls somewhere here, it is 45. So we can quantify the squint also. There are equipments for that, Synaptophore, and so many other equipments are there where we exactly know how many prism diopters squint they have, so that we can plan our treatment modality. This is a convergent squint. This is a divergent squint. That is, this eye is fixing, but this eye is looking towards the ear. It's turned towards the ear. So this is the dominant eye. The child is able to fix with this eye, but this eye is deviating. So these are all different types of squint. This is another type of cross eye where this eye is fixing. This left eye is fixing, but the right eye is looking up. It's a vertical squint, and so we check for what is the type of squint, what is the refractive error, and how many prism diopters, what are the eye movements. We check the muscles also. There are 6 muscles which move the eyes to the right, to the left, to the top, bottom, sideways, obliquely. So we check these muscles to see if there's anything wrong with the muscles, whether they are in coordination or whether anything paralyzed, if any nerve which is supplying the muscles are paralyzed. We do a extensive checkup before we decide the mode of treatment, which could be with very minor squint. One could probably do some exercises on the Synaptophore. And of course, there are some cycloplegic drops also can be given. There are some special eye drops, which some squints respond to that. But if very large squints, which are very like 45 degrees or 30 degrees and more, then we better to do surgery where we realign the muscles. We resect the weaker muscle, and we recess the stronger muscle, and we make the eyes parallel. The eye is like this, we make this eye parallel. The eye is like this, we make the eye parallel. So we very extensive investigation is done. Squint workup is done before the modality of treatment is decided, and also what type of treatment, and we do that, and it's a successful treatment. This is one of our patients, and this eye is fixing, whereas this eye is deviating out. This is a divergent squint. This was a small young boy. This is a fixing eye, and this is once again a diverging. This eye is turned towards the ear, this side. So this is a divergent squint. We did the squint surgery, and after the surgery, the eyes are absolutely parallel. You can see that both the eyes are absolutely parallel. This lady also has got a squint, and this is towards the nose. You can see that this eyeball is turned towards the nose. This eyeball is also turned a little towards the nose. But after the surgery, it is absolutely parallel. The eyes are parallel to each other. They work parallel. They look parallel. They move parallel. It is so important to have a single image. Now, what are red eyes? Many people come to us with red eyes, and this is you see this eye is so much inflamed, and this eye is white in color. It could be various etiology can be there. It could be due to bacterial infection. It could be a viral infection, adenovirus. Even COVID can cause a conjunctivitis. It could be allergic reaction to some cosmetics, or allergy to the pollen grains or dust or anything. It can be a fungal infection. It could be due to injuries also. When a person has a a small rubber ball hitting the eye, or a cricket ball hitting the eye, or any hard object, or there is a penetration of the eye with a pencil or a pen or a divider or a compass. Any injury can also cause a red eye. But we assess that we look at this eye, and we know from our experience, we can make out that this is what type of redness, why this redness is there. Then appropriate eye drops and eye ointments are prescribed. And sometimes when the inflammation is very much more, when the lids are all when the eyelids are all swollen up, then we give anti-inflammatory medications also. And if it's a purely infective etiology, then we give antibiotic. The swelling is quite a bit, then we bring down the swelling by using anti-swelling medication. There's a very common condition known as a cataract, which we all know. It happens in the older age group, that is senior citizens, and but it can also occur in newborn babies, what is known as congenital cataract. It can also take place when there's a trauma to the eye, traumatic cataract, and also when there are some inflammation inside the eye, prolonged inflammation can cause a complicated cataract. So there are various types of cataract, but we will right now only talk about the age-related cataract. Now, what is a cataract? I had told you that in the beginning, that we all have a lens inside the eye, and when the lens inside is absolutely transparent, the pupil here, this is the pupil, which is the opening in the iris, which will be totally black. It will be black in color. And when there's a cataract, you can see that this is all, grayish in color. This is cloudy. So cataract is nothing else but the natural lens becoming cloudy. When the natural lens loses its transparency and becomes cloudy, it is known as a cataract. Now, normal eye, when there's a normal eye, look at the picture here, you get a very clear picture of whatever we are seeing, because there's no obstruction, there's no cloudiness in the eye. Whereas you see here, there's a cataract here, so the same picture is so hazy. And so this is the symptom which they come and say, for the last 6 months, we are not able to see very clearly. Everything is so hazy. Nothing is well focused. And they come and show it to us. We check the vision. We put these people on an equipment known as the slit lamp. And we know that then we can see this cataract. And then we counsel them. We tell them. You'll be surprised if I tell you that there are thousands of varieties of cataract. I've just put some pictures here so that we understand, because most people think that cataract is the same for everyone, and the procedure is also the same for everyone. No, it is not true. When there's no cataract, this is how you have a black pupil. See the cloudy lens here? The cloudy lens, this is a different type of cataract. We call this cortical riders, triangles you can see, which are opaque. This is a total cataract. Total. This person will not have any vision. This is a black cataract, cataract nigra, very hard cataract. Here we see that only this portion of the thing is this involved. The rest of the natural lens is transparent. Here you see one disc-like thing known as the posterior polar cataract. Here you see, imagine the transparent lens becoming yellow color, yellowish brown in color like this. And this is a very hard cataract, absolutely brown in color. Here, this is a soft cataract, golden in color, easy to do. This is difficult to do. And this is a total cataract. Here in this person, you can see there's a total cataract in this side. These are all mature or hypermature cataracts where the vision will be almost zero. Now, the treatment modality is mostly surgery. We make a very small incision in the eye here, about 1.8 millimeters. We put a phacoemulsification probe, which goes inside, and then it pulverizes, it oscillates. The tip of the phacoemulsification probe oscillates very fast. It breaks up the cataract here, breaks it up into small pieces, and then it absorbs. It sort of aspirates. This probe has got 3 functions. One, fluid keeps coming inside the eye. It also oscillates very fast. It breaks up the cataract. It also sucks in, and it removes all the cataract. Totally, it will be an empty bag. The lens bag is empty. And then, because we have removed the natural lens from inside the eye, we have to put an artificial lens known as the intraocular lens, which the power of which we calculate before the surgery itself. There's a way of calculation. And we put a foldable, injectable intraocular lens inside. This goes inside the eye and expands and sets in position, and the person is able to see very clearly after this procedure. The various types of intraocular lenses are there: monofocal, multifocal. Multifocal has got an advantage in the sense you will be able to see both the distant vision and the near vision very clearly, whereas monofocal lenses are planned for distant vision, or and then they may have to wear glasses for reading. So we choose the intraocular lens according to what the profession of the person, what they want, what the expectation of the person, the needs of the person, the requirements of the person, the lifestyle, everything we take into account before we decide what kind of intraocular lens we are going to use inside the eye. There's another condition known as glaucoma, which is a very important condition which affects the elderly. It can also come in babies, what is known as congenital glaucoma, but that's rare. What we see is mostly in the elderly people. It's also known as the silent thief of sight. Untreated glaucoma can lead to loss of sight, so one should be very careful. One should be aware of this problem. And what is glaucoma? It is, we have a pressure inside the eye. We all know about blood pressure. That's a common thing. Everyone knows about blood pressure. Very few people know that the eye inside, the inside the eye, there is a pressure which is known as the intraocular pressure. The normal intraocular pressure is about 10 to 20 millimeters mercury, and if it's more than this, let's say 22, 25, 26, 28, 32, it can even be 60 in very high untreated glaucoma. Then it is known as we can suspect a glaucoma in these patients. What can it do? What happens when there's a raised intraocular pressure? The nerve fiber at the back gets damaged, and because of which the side vision, the field of vision gets affected. There are field defects in the eye, and this can be also recorded. We can check for the field of vision and know what kind of defects they have. And then the optic nerve at the back. We saw in the beginning how the images go through the optic nerve to the brain where we visualize things. So these things happen in glaucoma: high eye pressure, defects in the field of vision, and the optic nerve also gets damaged. So this is a field analysis, the side vision. How much is the side vision? The normal side vision will be like this. They'll be able to perceive everything. This is a field analyzer, octopus, and this is a very late stage of glaucoma. You can see that they are not able to see any of these portions. The side vision is so badly constricted, and what they're able to see is only the central vision, only the small portion. It's like a tube. We call this a tubular vision, as though looking through a tube. When you look through a tube, only see whatever the tube, the central vision, but the rest of the thing is blocked. This is what happens in a long-standing glaucoma. Of course, the early stages, we have small defects, maybe small area here, maybe the defects can be, various types of defects can be there, but this is a very late stage of glaucoma. We also run another test known as the OCT, optical coherence tomography, where this is the optic disc which gets damaged. So we see how much is the nerve thickness, what has happened to this nerve, what is the retinal nerve fiber thickness. That is what is analyzed in this particular thing. Here, normal is when you get a spike like this, double hump pattern. And also we go look at these parameters. The numbers are here. What is the thickness of the nerve fiber layer in the upper quadrant, lower side, we come to know. Whereas this is a normal picture, whereas this is an abnormal picture. You can see that here is a red zone. The numbers are all less than what is normal. And there is a flat, this black line is touching the red zone. It is coming into, it's almost flat here. There's no double hump pattern. So we know that the nerve fiber is, there's a damage to the optic nerve. And we analyze this and we keep the record. This is the normal fundus, we call that. This is the retina and the optic nerve. Look at the color of the optic nerve. This is orangish red in color. It is a normal optic disc. That is beginning of the optic nerve. This is how it should be. The normal color of the retina is orangish red. The optic disc is also orangish in color, reddish orange. And there's no white area here. But when there's a dropout of nerve fibers, when the nerve fibers start dying, you may get a punched out appearance like this. There's a cupping, we call this. This is about 50% cupping. That means some amount of nerve loss is there. This is 80% cupping. You can see that there's such a big white zone. We can see this is deep, and the vessels are all pushed to the side. This is an advanced stage of glaucoma. This is a total atrophy of the optic nerve. This is known as glaucomatous optic atrophy. Look at this color. This is white in color. There's no, it is not pinkish red. And even this nerve fibers are, it is not very, this thing. So this is the end stage of glaucoma. So one has to be very, very careful. One has to check with the doctor every year. And they will, because this is a thief of sight. That is, it is asymptomatic. There is no, the person may not even know that they have glaucoma. So it's very important that they have a regular checkup with the eye specialist, so that these things are all found out at an early stage before this kind of the late stage is not. We can prevent the late stage. We can protect the vision if you diagnose it at an early stage. The various types of glaucoma treatment is there. There are some eye drops. There are some tablets which bring down the eye pressure. There are some special lasers we do for this. And finally, if it doesn't respond to any of these, and there are glaucoma surgeries, there are many types of glaucoma surgeries. We can choose what is best, and we can do that. There are many people in the world who have diabetes, and diabetes can affect the eye, and it can cause a condition known as diabetic retinopathy. And if you are diabetic, please get your retina checked today, even though there may not be any symptom or any vision loss. As I told you earlier, this is the normal retina. It is orangish red in color. There's no white spot, no red spots, and this is a normal nerve head. This is the normal retina. But here you see these are early stages of diabetic retinopathy. Here you see some yellow specks here, which is lipid deposits. That is proteins and lipids. They extravasate and they form dots like this. Exudates, we call it. There are some hemorrhages here, red spots here, here, everywhere, and even this. There is a hemorrhage here also. So this is what is known as background or pre-proliferative diabetic retinopathy. And it can progress further, and that can be hemorrhage inside the eye, known as the vitreous hemorrhage, where you see a clot of blood inside the eye, and sometimes you get these fibrous tissue proliferations inside the eye. This stage is one of the late stages, known as the proliferative diabetic retinopathy. We run many tests for these people. There is something known as fundus fluorescein angiography. We inject a dye and see how much of blood vessels are normal, what is there. We get a lot of information in this fundus fluorescein angiography, and we decide what we should do, what kind of treatment we should do. We decide on this. There are various types of treatment. The first essential thing is to control the diabetes, be under a good diabetologist, control the blood sugar levels, and of course, as far as the eyes are concerned, one can do laser treatment. If there's a macula has got edema, then we give this, some injections are given inside the eye to bring down the macular edema. And in the very late stages, what I showed you in the last slide, we do a surgery known as vitrectomy. And if there's a blood inside the eye, if there's blood, I showed it in the previous slide. In those cases, we have to do surgical procedures to restore the vision. So when do you consult an eye specialist? When is it that we should see an eye specialist? When there is a watering in the eye, that can be many things attributing to the watering. It could be a very minor problem. It could be a major problem also. So better to go and show it to the eye specialist. When there's a discharge coming out of the eye, it can be a mucus discharge. It can be a pus coming out of the eye. Please do check with your eye specialist. When there's a itching in the eye, when there's irritation, when there's a foreign body sensation in the eye, when the eye is red, when there are injuries as an emergency, you should rush to the eye specialist immediately, should not waste any time. When there are pain in the eye, in and around the eyes, when there's a headache, some of the headaches are also due to eye problems. And then the cross eyes, we talked about this in detail, or this is also known as squint. When any defect is there, poor vision, people will say, we had excellent vision. We could see the bus number. We could see the television without glasses. We could read. Now it is not so. The vision is poor. So that in that case, and then there's any distorted vision. Sometimes they'll say that all the lines, instead of looking straight, they look wavy, and everything is looking a little distorted. And if that is a symptom, one must see an eye specialist. When there's a reduced side vision, very few people notice a reduction in sight vision, but there are people who are very, very observant, and they come and tell us we are not able to see the upper quadrant since the last 2 days. We are not able to see this portion of the field of vision for the last 1 week. They come with this symptom, then we must see. Similarly, reduced night vision. Night vision is in the night also we are able to see if there's a little bit of light. It may look all grayish in color, but we have night vision. There are some people who have no night vision at all. This can happen in vitamin A deficiency. People with intense vitamin A deficiency can have reduced night vision. There are some people with retinal problems. They can also have reduced night vision. And when there's a family history of glaucoma, because glaucoma can be a genetic thing, it may not come in every generation, but if there's a genetic predisposition, then one can inherit it from the grandparents or parents. So when it's a family history of glaucoma, one must go and see an eye specialist. And also those people with the diabetes, I talked to you in great details about diabetic retinopathy. Similarly, even high blood pressure, what is known as hypertension, can also have changes in the retina, known as hypertensive retinopathy. They may not be aware of it at all. Many a time we check the retina, then we ask them, then we confirm this thing, then we check the blood pressure, it is high, and the person may not be knowing also that they have a high blood pressure. Then there is a thyroid problem also. There are many eye changes which take place. Thyroid ophthalmopathy, we call it. And so people with thyroid also should have an eye checkup. All preschool children should have eye checkup done, because sometimes there's a condition known as lazy eye. The child is, one eye is very good, the other eye is not good. The child won't tell the parents. It will do everything normally, and to find out when there's a problem with one eye and not the other eye, or what is the type of vision they have, one should have a preschool. Before they enter the school, one should have a complete eye examination so that this problem is picked up. And also routine eye checkup is definitely indicated for everyone, because there are so many problems in the eye which have no symptoms whatsoever. And we diagnose it when we see the patient, we see the person, we check the vision, we check the fields, we check everything, and with eye pressure. Then there's so many the diagnosis is made at the higher hospital because they came for a routine eye checkup. And it is better to prevention, is better than cure. Identifying a problem in the early stages is so very important. Vision is so important for everybody. It's priceless, and so we need vision till the last day of our life. So if there's a problem, if it's diagnosed at an early stage, it is easy to treat for the eye doctor also, and we can prevent it from becoming worse. We can prevent the problem, maybe glaucoma, maybe diabetic retinopathy. It can be anything. We can prevent it from becoming worse and worse and worse, and save the vision of the person. It's very important that we all know about this. We should be aware of all these things, and we should be able to save the vision, which is extremely important. So we should have a regular consultation with the eye specialist, so that anything and everything can be picked up at a very early stage, and then the treatment can be given to prevent further deterioration, or complete cure of the problem also is possible. Thank you very much for your patient listening. I hope and pray that it was a useful program, and it would have made us aware of so many issues which we may not have known. I once again thank the Science Department of St. Joseph's College of Engineering for having given me this opportunity to interact with you and share this information with you. Thank you one and all. Thank you so much.
Thank you, ma'am. Thank you for your excellent information. I think you have brought the entire doctoral studies of eyes before us.
Thank you so much. Thank you.
Ma'am, there are some queries. I think I can post the questions, and
Yeah, certainly. Please do that. Please do.
Yeah, are you able to see the questions, ma'am?
No.
Is it safe to use contact lenses in the current situation?
One should really wash the eye properly, before we use the lens. The solution should be changed every time. And it's extremely important. We use soap and water and wash the lens very nicely. Then we put it in, and before we remove, also we should wash the hands nicely, and then change the solution in the lens case, and also wash the lens case every day, maybe twice a day. Also, one can use. One can use with caution.
Thank you, ma'am. What is the reason for long distance vision?
Long distance vision means I didn't get that thing. Now that is they cannot see the distant objects, and they can see the near objects. Is that what it is?
Yeah, I think so, ma'am.
That is known as short-sightedness. That is myopia. We give them we give them concave glasses, minus glasses, for correcting this short-sightedness when they are not able to see the distant vision, but they are able to see the near vision. There are spectacles we can give. Again, if they're more than 18 years, if they're able to handle a contact lens, we can give that also. And we can do a LASIK procedure also. So this is a part of refractive error. We check what kind of refractive error, and accordingly we can treat this person.
What are the disadvantages of LASIK laser surgery?
Yes. LASIK laser, we do a pre-laser checkup known as the OP scan. There's a scan which we do, which gives us all the details of the cornea, because this laser is done on the cornea. So we should know all the information about the cornea, about 200 different information. We'll get the curvature, so many things, the thickness of the cornea, everything this OP scan will tell us. Then we decide whether the person is suitable for LASIK laser or not. There are some people with very, very thin corneas, they may not be suitable. Then there are some conditions, special conditions, which we would say better not to have a LASIK laser done. But more or less, if all the parameters of the OP scan are normal, then one can do a LASIK laser procedure. And post laser also, we educate them, we counsel them, and tell them these are the post laser precautions which you should take. How to put the eye drops, how many times a day, how you should, what you should do, what you should not do. All the information we share, and we counsel the person. They understand very clearly, and if they follow all these, the LASIK is a very safe procedure.
Thank you, ma'am. I think eyes are very, very precious. But one participant asked, which one is best in our eyes?
Which one is best?
Which part is best?
Everything works together. Everything works together. Like how the body has to work together. The heart has to work. Heart can't say I'm better than the brain. The brain can't say I'm better than the hand. Everything has to work together. Like that, every part of the eye is important, including the eyelid, eyelash. Everything is important. Eyelid protects the eye. When there's some foreign body comes, some injury is going to be there, we immediately close our eyes. That protects the eye. So every part of the eye, from the eyelid on to till the optic nerve, and inside the brain also, it is important, and it's very important. All are very important.
One more question, ma'am. Is there any treatment for glaucoma?
Yes, we have treatment for glaucoma. We have eye drops. Various types of eye drops are there. And the first thing we always do is start on medical treatment. That is, we prescribe them the suitable eye drops, and then we call them frequently. We check the eye pressure, we check the field of vision. We run this OCT, optical coherence tomography test, and then we titrate that. We tell them, okay, you are doing well. You continue to use the same eye drops. And sometimes we may have to put two different types of eye drops, sometimes 3 types of eye drops, what is known as maximum medical treatment. If they are not, it is not controlling their glaucoma, then we can do some laser procedures. If that is also not controlling their glaucoma, then we do surgeries for that. There are glaucoma surgeries available. Many surgeries are there. We can do that.
Using a phone for a long time creates irritation in eyes. Is there any other remedy for reducing irritation?
People who use the laptop a lot, and those who use the cell phone also, they blink much less than the others. That's a study has been done. Normal people blink about 30 to 40 times. We blink like this, and we resurface the tear film. But when we looking at the laptop or the cell phone for a long time, we only blink about 7 times a minute. So there could be dryness of the eyes. Because of the dryness, one may have irritation, one may have discomfort, fatigue of the eyes. There are lubricating eye drops available for that. We also tell them, please use the cell phone to what is really required. What is really required. Maybe instead of using it. So people use wisely. They use it in a proper way. Then there should not be any problems. We could limit the duration of use of the laptop or the cell phone and use it only for essential things. Then I don't think there will be any problems at all.
One participant named Umesh, from birth, my eyes are in yellowish color. Can you tell the reason why my eyes are in yellowish color?
Sometimes people have yellow coloration of the white portion. Instead of bright white, it is little yellow. It could be a vitamin A deficiency. What we call this as a conjunctival xerosis, and then one can take a course of vitamin A. It's available, and sometimes this muddy conjunctiva, that discoloration, a little creamish or brownish color, it can come back to normal if you take a full course of vitamin A. One must see the eye specialist whether there's any other reason for this muddy. And one has to examine these patients with the equipment known as slit lamp. Then we look at the tear function. How much is the tear protection? There is a test known as the Shermer's test. We can evaluate the tear protection. Then we come to a conclusion. This is why the eye is muddy. Most probable causes are vitamin A deficiency.
Whether laser treatment cures a long sight problem permanently?
Long sight, as I mentioned earlier, by till the age of 40, the long sight also can be corrected. But after that, because of aging changes inside the eye, it takes place inside the eye. One could have what is known as the presbyopia, we call that. But people have at the age of 41, 42, 43. The long sight, yes, plus number power can also be corrected, minus number powers can be corrected, astigmatism can be corrected. But at the age of 40, they might require reading glasses at 42, 43, 44. The distant vision will be good, but they may require additional pair of glasses.
Even after wearing spectacles, what is the reason for the increase in power?
Aging factors in the eye, like how the skin ages, the face ages, the body ages. The aging is a normal phenomenon. Aging is a normal phenomenon, and eye also ages. There are some changes happening in the accommodation inside the eye. There's something known as convergence, accommodation. Even the natural lens, the elasticity of the lens also changes because of the age. In younger age group, the lens is very soft. As we grow older and older, the lens becomes a little harder and harder and harder. And this could be the reason why the spectacle power keeps changing as the age goes by. It's normal, nothing to get worried about.
Ma'am, can you explain some natural exercises to improve our eyesight?
Yeah, one can exercise is good for any part of the body. We can do that. We can move to the horizontal position like this, and then we can bring it and take it to the horizontal position here. Keep it for some time. Do that 10 times. Then we can take it up like this to the maximum position and not move the head. We should not move the head or the neck, only the eyes, and then bring it back down as much as possible without moving the head or the neck, and do that 10 times. Then we can do it obliquely, this way 10 times, this way 10 times. Then we can rotate the eye 360 degrees 10 times, then anti-clockwise direction 10 times. Then we can also keep a pen, focus on that, and then bring it closer and try to focus it. That improves the convergence inside the eye. There's something known as convergence that also those people with convergent insufficiency, that helps. So these are the various exercises one can do to keep the eyes healthy.
Ma'am, how can we naturally improve our eyesight? I think she has asked this in terms of food.
Well, good food actually. Balanced food is important. Balanced diet. Vitamin A is very important because the retina, it takes a lot of vitamin A, and that is the reason when there's a vitamin A deficiency, people have night blindness. They won't be able to see in the night, but they can see in the daytime. So a good balanced diet, a lot of carrots, cabbage, green leafy vegetables in all kirai we call it, or lettuce, all green leafy vegetables, and then those people a lot of milk, cheese, curd, and then non-vegetarians can take eggs, milk, then eggs, and then fish is very rich in vitamin A. Liver, those people who take they don't mind taking all these things, but they can definitely, they're all very rich in vitamin A. Eggs and liver and fish. So those who are non-vegetarians who take these things, all these things, if you take it in a balanced way, a little portion of we can we can take it in our normal diet, then there should not be any problems at all.
Thank you, ma'am. I think that's all.
Thank you, Dr. Kriba. Thank you so much for inviting me for this program. And I'm really grateful to St. Joseph's College of Engineering. I'm really glad that they gave me this opportunity. It was such a lovely experience for me. Thank you so much. Thank you very much.
Thank you, ma'am. Thank you. She's a founder of RK Eye Center, Chennai. Even in her busy schedule, she accepted our invitation and she was ready to give an awareness talk to the community. Thank you, ma'am. Thank you very much, ma'am.
Thank you so much. Thank you.
Participants, the feedback link have been posted in the chat box of YouTube. You can fill it up. Friends, I think you had a great time. Even in this lockdown period, from the elders to the younger ones, we all are spending time only before the gadgets. Since it takes time to change the reality which happens now, let us change our eyes to see the reality, because the eye is the jewel of the body. So taking care of our eyes are important. So stay safe and also healthy. Eyes, use them, don't lose them. Thank you, participants. Tomorrow at the same time, we have another interesting session with another doctor. So don't forget to log in the link.